A femoral neck stress fracture is a fairly uncommon hip injury, but it's a very difficult injury that often requires surgery. In this video, I'll explain why it's such a challenge, what symptoms to look for, what treatment options can help you heal and return to exercise. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, the femoral neck, if you're not really familiar with that, this is a model of the hip joint. The femur is the thigh bone, and then the hip joint is the femoral head, the ball. You don't really see it here because it's covered with ligaments, and the socket. The femoral neck basically connects the femoral shaft to the ball. So the femoral neck is this part right there where the ligaments are overlapping it. That's the femoral neck. And a stress fracture of that is just that. It's an overuse injury of that, basically that bone. Now, this is typically going to be runners or running athletes. And it's typically two groups of people. It's typically women in their maybe late 40s, 50s that are either going through menopause or they're just past menopause where their bone density is starting to drop, or high school or college female athletes that for a variety of different hormonal and eating reasons, diet reasons, things like that, they can have low bone density. And so that's actually a common group of people that get these stress fractures. Typically what you're going to feel is not buttock pain or side of the hip pain out on the outside of your hip. It's going to be groin pain deep in the front of your groin, especially with running or maybe even with walking, not so much at rest, even though it can start to hurt with rest as it gets worse. The reason this is such a dangerous injury and why you should go see an orthopedic surgeon if you're getting groin pain, especially with running, and that pain's getting worse and taking longer to heal and even getting into your daily activities, is that femoral neck stress fractures can be very dangerous. Basically, they can go on to not heal, and then because the blood supply to the ball basically runs up through the femoral neck, if that doesn't heal, you could develop avascular necrosis of your hip or even a non-union of that bone that then collapses and you lead to fairly advanced arthritis at could be an early age. So what you're looking for, x-rays are an important starting point, but a lot of times x-rays won't show a stress fracture early on, so the doctor will get an MRI. And if it shows a stress fracture, what's going to determine if you need surgery or not is where that stress fracture is. And if it's on the bottom side, the inferior surface of the femoral neck, that would be something that's what's called a compression femoral neck stress fracture. There are compressive forces across that bone, which can typically heal without any kind of surgery. That would just be something you'd put somebody on crutches with no weight bearing for 6 or 8 weeks, however long it takes to get it to heal. And if it heals, then that's all you have to do. On the tension side or the superior top, the top part of the femoral neck, there are what are called tension forces, meaning forces that pull the bone, the fracture apart, and that almost always does not heal. Those most orthopedic sports medicine surgeons are going to fix, and they're going to fix that quite quickly, usually with screws across the bone to compress that fracture and get it to heal. And then even after surgery, there would be a period of time where you're non-weight bearing. But it's important to get this looked at quickly and make sure that it's not missed, because that can be a real problem. So you're looking for groin pain in a running athlete, typically, usually females, doesn't have to be females, but usually females, either like I said, teenagers, early 20s, or in the 40s and 50s, where potentially low bone density is a risk factor. The surgery can do well, and you can get back to everything you want to do long-term if it's caught early and treated appropriately. But it's one that if it doesn't, can have a lot of negative consequences down the road if that fracture doesn't heal. All right, I'd love to hear your experience. If you've suffered a femoral neck stress fracture or really any hip injury, leave those in the comments below this video. Just understand, if you leave a question that is basically an ask of specific medical advice, I can't offer you specific medical advice. So what I do is I try to address that topic from your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start a new live stream like my monthly Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.